According to Andreessen-Yev, in the first 7 seconds of any public speaking, people decide whether to like you or not. And in the next 30 seconds, they decide whether to listen or not. So, thank you for being here today. I am Lamia ZIdan, Assistant Lecturer, Pediatric Department, Tanta University. And I am delighted to talk to you about an interesting neonatal case. Let's start. Our case is a full-term neonate who was born to 25, para 2, gravity 2, healthy mother with unremarkable medical history and adequate prenatal care. He was delivered by cesarean section with birth weight 4 kilograms, and his Apgar score was 8 and 9 at 1 and 5 minutes respectively. The mother's pregnancy course progressed smoothly without any complication. There was no history, prenatal or family, to any inherited condition with negative consanguinity. The baby physical examination showed, as we can see here, a widespread port 1 stain on the anterior abdominal wall and the lateral aspect of both lower limbs, with superficial varicosities on the anterior abdominal wall. Also, his lower limbs were grossly hypertrophied, with a slight, more on the right side, with a slight lens discrepancy and macrodactyly of both feet. He was vitally stable, with normal examination of other body systems. Well, let's take a minute to summarize what we have found by history and clinical examination. He's a full-term neonate presented with a port 1 stain, superficial varicosities on the anterior abdominal wall, and grossly hypertrophied both lower limbs, especially on the right side. Accordingly, I believe you all agree with me. Accordingly, I believe you all agree with me. This is a case of congenital vascular malformation presented with cutaneous manifestation, and consequently, we should exclude internal organ AV malformation and its complication of present by radiological imaging and laboratory tests. Additionally, of course, genetic study is crucial in this case. Regarding the radiological study, Doppler ultrasound showed normal arterial and venous systems of both lower limbs. Also, cranial and abdominal ultrasound were normal, excluded any internal organ arteriovenous malformation, and the Doppler confirmed superficial varicosities on the anterior abdominal wall. In addition to a plain X-ray of the lower limb showed slightly increased length of the long bone of the right lower limb. Finally, abdominal MRI was unremarkable. In accordance to the laboratory tests, all hematological and biochemical investigations were within normal limits. Furthermore, genetic study was done, but the result is still pending. Now, let's recap on what we have found in this case till now. After complete workup, we can confirm the 3 clinical findings we have already mentioned before, besides exclusion of any internal organ arteriovenous malformation or any other congenital anomalies. Consequently, the diagnosis is clearly one of the associated congenital vascular malformation with congenital limb overgrowth. And the differential diagnosis includes Clove syndrome, Parker-Weber syndrome, Proteus syndrome, and Klebel-Trenaunay syndrome. CLOF syndrome is manifested by granulomatous limb overgrowth, vascular malformation, epidermal nevus, and spinal deformities. The last two components are absent here in our index case. Hence, CLOF syndrome can be excluded easily from our differential diagnosis. Parker-Weber syndrome is characterized by capillary malformation, limb overgrowth, and AV fistulas that weren't caught in this neonate. Hence, Parker-Weber syndrome isn't our diagnosis. Proteus syndrome is presented by adipose tissue deposition, vascular or even tumor malformation, and cutaneous nevus that isn't present in this baby. And so this isn't a case of Proteus syndrome. On the other hand, Klebel-Trenaunay syndrome is characterized by a triad of capillary malformation in the form of port wine stain, superficial varicosities with limb overgrowth, bingo. This triad is perfectly met with our baby. Hence why this neonate is a case of Klebel-Trenaunay syndrome. And according to the 2018 classification of the International Society for the Study of Vascular Anomalies, Klebel-Trenaunay syndrome is defined as a combination of capillary malformation, venous malformation with limb overgrowth, and with or without lymphatic malformation. It's a very, very, very rare condition with an incidence rate of about 1 to 100,000. Klebel-Trenaunay syndrome is a genetic condition which is presented clinically either by the classic triad we have already mentioned before or by its complications, including venous thromboembolism, Kazabach-Merit syndrome, venous thrombophlebitis, and GIT bleeding. As regards to the diagnosis of Klebel-Trenaunay syndrome, we briefly spoke about it earlier. It's mainly based on the classic triad or clinical finding, genetic study, and the imaging studies, such as Doppler study, ultrasound, CT, or MRI, to show the soft tissue overgrowth and the AV malformation. Currently, there is no approved medical treatment for Klebel-Trenaunay syndrome. However, multidisciplinary management should be focused on reduction of symptoms and complications. Recently, sirolimus is emerging as a new treatment hope for cases of Klebel-Trenaunay syndrome, especially severe venous and lymphatic malformation. At the end of my presentation, I would like to salute the two French physicians who reported the first case in 1900 and started a timeline which is passing through us here and today in 2021. Thank you.
شكرا جزيلا دكتورة لميا. الحقيقة حالة واضحة ومتهيألي ان الحقيقة الكيس برزنتيشنز دي من الحاجات الجميلة ان احنا كل مدة بنشوفها وبندور وراها وبنجيبها، ومش عارف حد من الاودينس له اي كومنت على اعتقد الدكتورة لميا استوفت. اتفضلي.
انا بس عايزة احيي الدكتورة لميا على الاكسنت بتاعتها وعلى الثقة في النفس. الأول كنت مهزوزة شوية وبعد كده بحب أنا البنات الحلوين اللي زي كده. شكرا دكتور.
شكرا لمياء. الاتراكتيف والبرزنتيشن كان سموث ودايركت زي ما بيقولوا يعني، وده حاجة كويسة طبعا تحسب لك. أنت قلتي ويز روزات ليمفاتيك افكشن. طب أنت عملت ستاد الليمفاتيك افكشن؟
بالكلينيكال اكزامينيشن ما كانش في الليمفيديما اللي هي كاركترايزد.
لا يعني عملت انفستيجيشن.
انما الانفستيجيشن الدايركت للليمفاتيك الوسم ده لا، ده مش موجود في مصر.
ما عملتيش؟ اصل انت
مش موجود في مصر. لا
والله، ما عشان كده يعني مفيش حاجه تقدر
لا. بنعتمد اكتر على الكلينيكال هنا في مصر.
ده صح يا لمياء، للاسف مفيش في مصر حاجه نعملها عشان
مفيش حاجه في السونار ولا حاجات دي تبين لنا دلوقتي.
لا.
طب ما نعمل حاجه يا ريس كده، حاجات. ايه رايك؟
شكرا دكتور لمياء، شكرا.